What's up, you guys? My name is Miguel, here to give you your daily dose of radiation. Today's video, we are covering top ways I've seen fellow beloved X-ray techs get hurt in our field of radiology. So, to give you context, I'm a night shift X-ray tech. I've been doing it for about 4 years. So, a lot of the times, our people end up getting hurt mainly when transporting people or moving people onto the table or trying to shove the little X-ray tech board behind them. That's kind of where our people get hurt. Or trying to standing up for a 2V chest X-ray or L-spine. That's kind of the time you can kind of get hurt. The most recent time I've seen someone get hurt, and it hurt bad, it's probably in CAT scan when they were transferring someone to get onto the table and the patient kind of got dizzy, and the patient was pretty large and the tech was pretty small, and like the patient fell on the tech fell back and hit their head and somehow like ended up messing up their spine and got hurt. I think they might have needed surgery, I can't remember, but it got pretty bad. So I think they got a hernia or something, I can't remember. So our job do come with some risk involved, even outside of just the radiation. It's not a requirement, but majority of the injuries I see involves just because either the patient was really heavy, they weren't stable, or the tech themselves weren't in the best physical shape. This job comes with a lot of physical stamina, and both I would recommend to go work out, do some kind of physical activity outside of work and get your muscle gains on, because even me, who I've started to work out and I've done pretty well for myself, if you work with someone who's in decent shape, it will make your job way easier. It will reduce liability, like of someone getting hurt, and even if they do fall, you can either withstand the patient or minimize the damage that will come. Even just placing the board and doing your job will significantly increase. There's been times, and I don't like to make fun of people or stuff, but there's sometimes we have certain techs that come in and they're very, very petite and skinny. And I'm like, I hope to God and I pray for you that you don't get some of these behemoth patients and they fall on you, or you're not able to perform your job and place the board behind them because of their weight. And I would say that's pretty embarrassing sometimes, especially you'll have times where if you have to, let's say you have to do a chest X-ray on the floor, let's say ICU, and the doctor finished putting in whatever, and they'll just sit there. It's not their job. They won't help. Sometimes there will be no nurses, and it's up to you to shove the board and get the job done. To me, I've never had a problem doing that, but there's been times where some of the techs will literally come down from the floor and be like, "Hey, Miguel, I need you." And I'll go up there and I'll be like, "This is the patient. You couldn't do it." And sometimes you will struggle. Some people struggle to get the board behind them, and the doctors are cool, they'll help you. If the nurses are cool, they'll help you. Other times they'll just watch you struggle. And I ain't nothing more embarrassing than you can't get the job done, not because you can't, but you're just limited by your physical strength to do your job. That's kind of embarrassing to me, but I would try to increase your strength and try to get some muscle on you and because it will make your job significantly easier. There's been times where me and my partner will go and try to do something like KUBs, and they'll try to place the board and then they'll struggle, and then I'll just come in and just and then just it'll slide in like butter, and they're like, "Dang, I really am not strong enough to do it." And I'll be like, "Well, at least you got me." So, but you can get hurt. I will say your wrist and your forearm, it starts to, especially if you work on godly amount of overtime like I do, they do start to wear and tear. That's what I've noticed a lot. My wrist and my forearm are starting to hurt. So keep that in mind. So I would say you can mitigate that by working smarter, like literally working out, getting a little bit of buff you can. But obviously, even regardless of all this stuff, at the end, if you do it long enough, you'll have some kind of like probably arthritis problems, kind of. But you can minimize at least some of the damage. So yeah, it's been your boy Miguel. See you on the next one.